Struggling to remember cardiovascular diseases? Mnemonics make complex cardiology topics easier to recall, helping healthcare professionals and students apply critical knowledge in real-world scenarios. Watch and master them in minutes. Understanding cardiovascular diseases is crucial for medical professionals. Mnemonics serve as effective tools to recall intricate information swiftly. The mnemonic Pirates helps remember the causes of atrial fibrillation, pulmonary issues, ischemic heart disease, rheumatic heart disease, anemia or alcohol use, thyrotoxicosis, electrolyte imbalances or endocarditis, and sepsis or sick sinus syndrome. ABCDE outlines the management of atrial fibrillation, anticoagulants to prevent stroke, beta blockers for rate control, calcium channel blockers as an alternative, digoxin for heart failure patients, and electrophysiology or antiarrhythmic drugs for rhythm control. To recall myocardial infarction complications, use Darth Vader, death, arrhythmia, rupture, tamponade, heart failure, valve disease, aneurysm, Dressler's syndrome, embolism, and reinfarction. CREAM assists in remembering aortic regurgitation causes, congenital anomalies, rheumatic damage, endocarditis, aortic dissection or root dilation, and Marfan's syndrome. Another acronym for memorizing the causes of aortic regurgitation is VINDICATE: valvular, infective endocarditis, non-rheumatic causes, degenerative, injury, congenital, aortic root disease, toxicity, endocarditis. A handy mnemonic for remembering the order of blood flow through the heart is try pulling my aorta, or TPMA, tricuspid valve, pulmonary valve, mitral valve, aortic valve. The Band-Aid mnemonic covers heart failure drugs, beta blockers, ACE inhibitors, nitrates, diuretics, antiplatelets or anticoagulants, inotropes, and digoxin. The mnemonic chest pain is a great way to remember the symptoms of a heart attack: chest discomfort, pain, heavy feeling, excessive sweating, shortness of breath, tingling, pain radiating, anxiety, indigestion, nausea. The FAST mnemonic is a simplified version to quickly identify the most common symptoms of a stroke: face drooping, arm weakness, speech difficulty, time to call 911. Another acronym to easily recall the warning signs of stroke is BE-FAST: balance, eyes, face drooping, arm weakness, speech difficulty, time to call 911. If any of the above symptoms are present, call emergency services immediately. Time is crucial when it comes to treating a stroke. The APET mnemonic helps you remember the key auscultation areas of the heart, focusing on the locations to listen for heart murmurs, heart sounds, or any abnormal rhythm. Aortic area, second ICS, right sternal border. Listen for aortic valve murmurs. Pulmonic area, second ICS, left sternal border. Hear pulmonic valve sounds. Erb's point, third ICS, left sternal border. Detect aortic/pulmonic murmurs. Tricuspid, fourth ICS, left sternal border. Listen for tricuspid valve sounds. An alternative way to remember the key areas for cardiac auscultation is with the mnemonic All Patients Take Meds, or APTM. Aortic area, pulmonic area, tricuspid area, mitral area. Mnemonics like such are invaluable for mastering cardiovascular topics, enhancing both learning and patient care. Thank you for joining us on this journey through cardiovascular mnemonics. Deepen your understanding and access more resources at latrinawaldenexamsolutions.com. Empower your learning and elevate your practice today.